You know, some injuries need immediate medical attention from a professional, but what about those smaller at-home injuries that you can probably handle yourself? Well, today we are talking to Dr. Ryan Abushan of Novant Health Forsyth Pediatrics. That's in Summerfield. He's a pediatrician. He's going to answer your questions about treating those at-home injuries. What we want to be able to do is give you the opportunity to ask your question. So you can text us your question. The number is 336-379-5775. Remember, your questions are anonymous, but this is your chance to get an expert to answer your question live on TV. All right, so summer injuries. This is stuff that, just happens, like a bee sting, for instance. How do we at home treat a bee sting, and at what point do we need to ever see a doctor for it?
Hi, Tanya. Thanks for having me on the show. Bee stings, it's summertime. We're outside. It's nice out. And so these are things that happen. And so if a child does have a bee sting, the first thing is you want to make sure that the stinger is not still attached to the skin. So you can typically help with this and just get a fine tweezer and pluck the stinger right out. So once you've done that, anytime we have a bite or a sting, we want to clean the area with some mild soap and water. Early on, stings hurt, so usually they'll be red and swollen and painful. And so to help with that, you can put ice on the area or a cool compress, and then certainly could give a dose of Tylenol or ibuprofen.
Okay.
Sometimes about 10% of people will have a large local reaction, so which is just what it sounds, where the area is really swollen and red. It's not a true allergic reaction, but it's something that we see with bee stings. So.
Okay. All right. But if they have any kind of problems with breathing or anything like that, they should immediately call 911.
Correct. Yeah. If there's any signs of anaphylaxis or severe allergic reaction, this would be mouth swelling, vomiting, trouble breathing, go straight to the nearest emergency department or call 911.
Okay. I just did a story about Lone Star ticks. Ticks are something that are very, very common in our area. What happens if someone finds a tick on them? In fact, you just had that today, didn't you?
Yeah. I'm actually, the last patient I saw today was a little boy. He had a tick crawling on his sock, and I actually got it. It's right here. So, pediatrician's favorite quote is from Benjamin Franklin. It's an ounce of prevention is worth a pound of cure. And so when we're out, especially in heavily wooded areas, we want to try to prevent the tick from getting on us in the first place. And so you can do that by applying an insect repellent with DEET, also wearing a shirt with long sleeves and pants to prevent the tick. But sometimes ticks get on you anyways, and if you find one, we don't want to put nail polish on the tick. You don't want to cover it with Vaseline. You don't want to burn it. Again, you want to get some fine tweezers, and you want to attach the tweezers as close to the skin as you can, and just sort of steadily pull the tick out with gentle, even pressure. We just want to get the tick out of there, off the skin as soon as possible. Once the tick's off, then just clean the area with soap and water or rubbing alcohol. It's the first things that you do.
All right, but what happens if you can't get the tick out or part of the tick is left inside the skin? Then what happens?
Yeah, so if some of the tick is left embedded in the skin, you can leave it alone. We want to remove the tick from the skin. But if a little bit gets left behind, you can leave that and then give it a little bit of time. And usually things like that will work their way out with a little bit of time.
Okay, and then all of us are scared about if a tick bites us, what's going to happen next? Are we going to get something? So what should we be watching out for immediately?
So most tick bites don't cause any illness or disease, but certainly ticks do carry disease. You want to watch for signs of infection to the area where you were bit. So redness, streaking redness, drainage at the site where you were bit by the tick. As far as systemic symptoms, so Rocky Mountain spotted fever and Lyme disease are two big things that we watch for. So typically these would occur within the first 2 to 3 weeks after the tick bite. And so you want to watch for kind of like flu-like symptoms, so fever, headache, fatigue, joint swelling and pain. These types of symptoms usually will occur within the first 1 to 2 weeks, but beyond 30 days, typically you won't see any illness.
Okay, and we need to go to the doctor if we see any of those kinds of things.
Correct.
Okay. All right. What about it's s'mores time, right? And so we're all doing the s'mores over the campfire. Every once in a while, someone gets kind of a minor burn here and there because of that. When should we treat the burn, and what should we treat it with? And then when should we go to the doctor?
So thankfully, most burns are superficial in nature. We used to call first-degree burns, and just involve the outer layer of the skin of the epidermis, and are essentially like a sunburn. For those, you can treat at home certainly, and you want to cool the area. Don't want to put ice on the burn. Just you could apply a cool tap water or like a a cool saline soap gauze, and treat the pain of burn with Tylenol or ibuprofen. But any burn that's either quite large or is deeper than superficial, so it goes down, so we call these partial thickness burns or full thickness burns, these need to be evaluated either at the clinic or the urgent care or the emergency department because of risk of infection with these types of burns.
Okay, gotcha. All right, so let's talk about like just your typical first aid kit. So sometimes we get a first aid kit and we stick it underneath the sink and we haven't seen it in like years. What should we have in our first aid kit? What do we need to keep up to date?
I always have Band-Aids, a topical steroid cream like hydrocortisone because bee stings can be very itchy. Benadryl is a good thing to have on hand. Pain medicine like Tylenol or ibuprofen, and then some gauze and something to clean wounds with like hydrogen peroxide. Those would probably be the kind of the bare necessities.
Okay, and someone's asking, is there like a good treatment or anything for chigger bites? You like the no-see-ums, those kinds of things?
Yeah, those can be extremely itchy. I'd start with applying a topical steroid cream like hydrocortisone. You can do that twice a day for up to 2 weeks. And then treating with an antihistamine like Benadryl. You can do Zyrtec in the morning or Allegra, Claritin in the morning, and the Benadryl at bedtime because it might make you drowsy.
Gotcha. Okay. All right. So what we're going to do is we're going to be taking your questions when we come back. 336-379-5775. We'll see you in just a few minutes.